and on the Fox Business Network. We're going to talk to Senator John Thune in just a minute. So, South Dakota. Maybe, sometime this morning we ought to play that Rapid City, South Dakota, Kinky Friedman song, Lou.
Oh, gotta. Yeah.
Is Senator Thune on the phone, Bernie?
Yes, he is.
Yes, sir, Don.
How are you, sir?
Happy Monday to you.
Merry Christmas, Happy New Year, all that stuff.
Yeah. Well, we may be spending Christmas and New Year's here with Harry Reid in Washington. We'll see.
So these 5 songs that they gave us, Boston, Martina McBride, Journey, REO Speedwagon, U2, did you pick these or somebody on the staff? How'd that work?
It was a collaborative effort.
Did you pick them thinking that we would critique your selections?
No, but I kind of expected that on your show my selection would get critiqued. But
well, they're all good, though.
Okay, well,
so we had no complaints.
All right, well, I'm kind of a 70s rocker, and then I'm a country music guy, so that's kind of what you got.
So yesterday, Senator Thune, all over the talk shows, they were talking about the health care plan. Senator Lieberman said, I guess in a rather petulant act, is not going to vote on anything. What do you make of that?
Well, I mean, I think, God bless Joe Lieberman for being a guy who stands by his convictions. He has said all along that he won't vote for anything that has a government-run plan in it. And the latest plan is probably the biggest foray into government-run health care so far. I mean, when you expand Medicare, that is government-run health care. And so what Joe Lieberman has said is that this latest proposal that they put forward is a non-starter with him, and he will vote against it, which makes their job of getting to 60 that much more difficult. But I think they know what it takes to get Joe Lieberman. They've got to drop that idea. The problem is they start losing other people when they do that. So it seems like this thing's unraveling a little bit right now for them, and obviously I think public opinion's turning against it out there too. So we'll see how this week goes. I think this week's going to be pretty determinative in how this thing comes out.
In fact, all these polls suggest, no matter who takes the poll, whether it's the New York Times or Fox News, that the public is not interested in any kind of health care. Well, I mean, I guess they're interested in a health care plan, but not this one, not at least what they've heard about it.
Well, I think what the problem they have with this one and what they've heard about it is the basic core elements of the plan are the same. I mean, they tweak around the edges and they try and mess with the public option idea or the government plan to try and draw more people on board, but you still have the Medicare cuts, the tax increases, and at the end of the day, according to all the referees, the Congressional Budget Office and the actuary at Center for Medicare Services, who's the guy who's supposed to look at these things objectively and not with a political taint, they're all saying that this actually is going to increase premiums. So if you're the average American out there and you're saying, okay, they're going to spend $2.5 trillion of my tax money, they're going to raise taxes and cut Medicare for my parents or my grandparents, and at the end of the day, I'm going to be looked into higher premiums. That doesn't sound like a very good deal, and that's, I think, why public opinion started to turn against it.
What, back to the healthcare thing, the another aspect of it, what would be wrong with allowing, lowering the age to 55 to insure more people?
Well, I think the problem with if you can do that, obviously, but you have a program right now in Medicare that's going to be bankrupt about 5 or 6 years ago. It's a sinking ship already, and it's going to be insolvent. So what you'd be doing is taking an insolvent program and cutting $1 trillion out of it, which is what this plan would do, and then putting more people on the ship. And I think the other problem it creates is for everybody else out there who gets their insurance in the private marketplace, Medicare doesn't reimburse enough to hospitals and doctors for them to recover their costs. And so what they do is they shift costs over to everybody else that gets their insurance in the private marketplace. So everybody else's insurance premiums would go up even more. You would make the cost shifting that's currently going on worse. So I think it's people who have Medicare like it, obviously. My mom and dad are 89 and 90, and they depend on it. But extending it to people, growing the number of people who would be on Medicare only makes the financial problems for Medicare that much worse. 89
and 90?
Yeah.
How great is that?
Still kicking. Yeah.
How long have they been married? Like 50, 60 years, something like that?
Yeah, they passed 61, 62. They still live in my hometown of 612 people in South Dakota.
So. Man, God bless them. So,
yeah.
Well, Senator McCain's hair was almost on fire. He was on the program. Well, his hair wasn't on fire, but I'm going to say his hair was on fire because he's so mean to me. So I
can't imagine that.
Trying to save money on Medicare. So, and I guess for all the reasons you just said is the reasons he doesn't want to do it, right?
Well, it is, and John's been very engaged, and obviously he has great passion on this. He's a great spokesman for us, and he's been out there really making the argument for why this would be a bad idea. But I think he is, he's sort of making the same basic arguments that I am. And I think that one thing I will say too, which if you take this idea of expanding Medicare in places where I come from, in the middle of the country, where you have a lot of geography and not a lot of healthcare providers, most of their patients are Medicare recipients, and if they're losing money on all of them, and you expand that, you have fewer and fewer people to cost shift to, and they're saying that about 20% of hospitals are going to go out of business. So it creates an access problem too, and those are all the arguments, obviously.
He said, McCain said, if he had your face, he'd be president.
Yeah, I've heard that line a few times before, and I had John's he's a great American, and I had the chance to campaign with him when he was running last time around, and I certainly wish we'd have been successful, but he's doing great work in the United States Senate, and I'm proud to serve with him.
I went with him one time from his home in Cottonwood up to an old abandoned mining town called Jerome in Arizona, right near where I grew up. And him driving, never ride with him when he's driving. And I was so annoyed because Jerome is an old mining town built on the side of a mountain, and it's full of tourists and stuff. And they were all asking him for his autograph, and not one person recognized me. So
I find that hard to believe.
That was an annoying moment. Speaking of faces, as long as you've got your face, do you want to be president?
I tell you what, that job's got a lot of problems. I'm happy being the senator from South Dakota. I've got to run for re-election of that job next year, and we're just doing everything we can here to kind of slow this train wreck in Washington down right now. So that's where my focus of my efforts is.
So in other words, the answer is yes. Yeah, of course it is. So you play basketball, don't you?
Not much anymore, but in my day.
Aren't you 6'4", or something like that?
Yeah.
So one-on-one, you and the president, who'd win that?
Well, I guess, is he really stopped smoking yet or not? I'm not sure. I think that might have something to do with it. But
I don't think he's stopped smoking, but I think he's pretty good. So.
Yeah, I think he is good.
Yeah.
That's what I hear. I'm not waiting for my invite, so maybe you can facilitate that.
Oh no, I don't think that'll happen. We're talking with Senator John Thune here in the Imus Morning Program, 16 till the hour. What's your position on Afghanistan?
Well, I mean, it's a tough fight. I think we have to. There's a reason why in 9/11 we were attacked, and it's because we allowed these terrorist organizations to find a place where they could train and plan and execute attacks against the U.S. And I think we have to prevent that from happening in the future. My view is that the president, although took him a long time to get there. When he did make a decision, I think made a decision that we're gonna win this fight, and I think that's the correct one. I mean, I know it's a very controversial decision, and obviously people across the country are very conflicted about it. But at the end of the day, we have to be able to defend the country, and I think right now the greatest threat that we face in the near term and to some degree in the long term too are these radical Islamic extremist groups that are intent on figuring out ways to kill Americans. So we've got to stop them.
When you say win, what does that mean?
When I say win,
yeah, what do you mean by win?
Oh, win. I'm sorry. Well, I think that for me, it's making sure that organizations like Al Qaeda are not free to create safe havens and sanctuaries in Afghanistan and launch attacks. Now, I think that area of the world is always going to be tumultuous. I don't think we can ever presume that we're going to be able to establish an American-like democracy in that country, but to me it's all about America's national security interest, and I do believe that our national security interests are well served by ensuring that these terrorist organizations aren't able to use Afghanistan as a place to plan and launch attacks.
Hamid Karzai said the other day that it would be 15 to 20 years, not July of 2011, but 15 to 20 years before the Afghans would be able to, marshal any sort of resistance to Al Qaeda and the Taliban themselves and provide for their own security. What do you make of that?
I think that my sense is, and this is based on what feedback obviously we get from our commanders there and our troops, that their police force and their army don't have the capacity or the capability yet to take on the fight themselves, but that should be the goal. And I think we can get to where they have that capability sooner than that. What he said, I think, was we're not going to be able to finance this war for another 20 years, and that may be true. But I would prefer, I guess, if we have the option, and America's going to have a role there, we have to help finance their own security forces and let them do the fighting as opposed to our guys doing the fighting. And I think the goal right now in the near term ought to be to, as quickly as possible, get those Afghan security forces up to the task of protecting their own people and taking over more and more of the battle space, so that we can start moving our troops back home.
And finally, here at 13 till the hour, you know Sarah Palin?
I've not met Sarah. My wife has. I know, of course, know of her, but I've never had the opportunity to meet her.
She have the chops to be president?
I think she's a very talented lady, and I wouldn't put that. I mean, I know there's a lot of debate about that around the country, but I think anybody who has governed a state like Alaska and has been able to be in a number 2 slot on a major candidate or a major ticket for a major office in this country has certainly acquired a lot of experience that would equip her for that job. I'm not going to pass any judgment on that. I think that she is a major player in the Republican Party political scene and frankly, in the political scene of the country, and will be for the foreseeable future.
In other words, not really. Cool.
Well,
okay.
No, I would say Is that how you're interpreting what I'm saying?
Well, of course.
No, I think she's up to the job.
I was born at night, but not last night. Merry Christmas, Happy New Year, Senator. Thank you very much.
Same to you, Don.
Yeah, it was fun.
Bye now.
Senator John Thune here in the Imus Morning Program, 12 till the hour.